Hi, my name is Ryan Bourne. This is Communications 1010. It's May 31st, 2012. Today I'm going to be speaking to you a little bit about the Do Not Resuscitate order. We've all heard the saying, the only thing certain in life are death and taxes. Today I'm going to skip over all those years of forking over money to the government and focus on the death and the process of dying. Unfortunately, everyone will encounter this phase of life, but how each person deals with it varies greatly. During my time as a nurse, I've gotten to experience each end of the spectrum. I've seen a brain-dead patient with no hopes and change of cognition, getting every available medical intervention possible, as well as a terminally ill patient whose family wishes were to keep them as comfortable as possible as they encountered their end. Unfortunately, the DNR order is an underutilized order in today's terminally ill patients. Although it seems humane to try to keep your loved one alive by using any means necessary, it often causes the patient to bear an inhumane amount of suffering. The term DNR stands for Do Not Resuscitate, which is only valid if written by a physician. It tells healthcare workers that you do not want to have cardiopulmonary resuscitation provided in the event of cardiac or respiratory arrest. Anyone can choose to be a DNR. Some things to consider while choosing this are your overall health, whether you're terminally ill or not, whether you're suffering from advanced age, whether the prognosis of your diagnosis is a good one or a bad one, as well as the quality of life you wish to sustain afterwards. According to an interview conducted by Heather Kim, when Dr. Charles Wright, committee chairman of Vancouver Hospital and Health Science Center, was asked about the use of CPR in terminally ill patients, he stated it was very bizarre that this was used so often. Unfortunately, in today's era of modern technology, we are filled with unrealistic expectations of what science can do to save our life and our loved ones. Some of the technological advances we have are ventilator-assisted breathing, where you have an endotracheal tube placed down your throat and a ventilator breathes for you, keeps you alive. We also have cardiac medications to slow and speed the heart, and we can also change your cardiac rhythm. We can also implant a pacemaker or transdermally pace you. We can also provide you with physical therapy, range of motion, put you in cardiac chairs. We can increase your muscle tonicity. All these things can be done for a patient, but one has to ask themselves, are these treatments morally and ethically right? Is prolonging the inevitable achieving any foreseeable goals? Or is this treatment just torturous to the one going through it? Lastly, before someone makes the decision to go forth with CPR, they need to be educated on what this process entails and some of the trauma that is sustained by the body post-initiation. Some common CPR traumas include broken ribs and a broken sternum from chest compressions that are done too hard, anoxic brain injuries with irreversible damage, as well as multi-system organ failure. One must keep all these factors in mind when deciding whether or not they want CPR initiated. A patient who is 90 years old with a multitude of medical problems will most likely not ever be rehabilitated from these injuries. Therefore, quality of life becomes a major concern. Brady Tomlinson, who is part of the Resuscitation Council in the UK, says, "It's tragic to see a patient who has survived CPR being nursed in an intensive care unit and then left to die an undignified and slow death. This is a common practice here in the United States, and it's almost unbearable to watch a patient going through this agony." In the end, everyone should be afforded the opportunity of life-saving interventions in the time of crisis. But understanding the complications that come after medical stabilization is key to deciding whether or not you want these actions to be taken. Recognizing whether or not you've just initiated a painful, undignified death that involves only suffering will hopefully persuade more to please become a DNR and let the suffering stop for you and your loved ones.